My name is Nigel Pollard. I'm the chair of Empowered by Evidence, which is a New York-based non-profit to support scientific evidence and natural health products. So my background is in biochemistry, where I found a particular interest in pharmacology. And then in 1987, I joined the pharmaceutical industry, working in prescription products for cardiovascular disease. I worked in many markets around the world and ended up in Australia. And by this time, I've become a passionate believer in natural health products. I'm amazed by their complexity and the potential of their multi-target pharmacological actions. So now my personal mission is to secure a role for specific evidence natural health products as mainstream medicines.
Hi there, Nigel. So I also know that EB has accredited products that contains valerians and also hops. Could you tell me about this product? And I know the name's ReDormin, right?
Yes, that's right. So there's a product that contains a combination of Valerian officinalis and Humulus lupulus, which is the botanical name for hops. So it's hops and valerian combination. This product is called ReDormin in many countries, and it has the code name ZE91019. It's owned by the leading Swiss natural health company Zeller, and it's sold under ReDormin in most countries. To find the name and how to buy it in your country, you need to visit our database at empoweredbyevidence.org/EBE-database.
Thank you for the details. Now, do you have any interesting facts about the clinical trial on the product?
Yes, so the EBE has reviewed several studies on ReDormin. It's been used compared to placebo in mild non-chronic insomnia. And what it does is it appears to reduce the time to get to sleep, as well as time asleep during the night. It's been compared with synthetic sleep products, one's called diphenhydramine, and shown similar effectiveness but better quality of life. So people tend to feel more refreshed when they wake up taking ReDormin. And sometimes it's really the kind of quality of the sleep and not necessarily the length of the sleep that's the most important thing for people. It has a very interesting mechanism of action as well. So it acts a little bit similarly to melatonin, and so it helps to reset the sleep if people are waking up regularly in the middle of the night. But you do need to take the product for a month to get the full effect as well. So compared to synthetic sleep products or melatonin, it's more of a complete package in helping people to sleep better, reducing anxiety, resetting what's called the sleep architecture to help you get back to a normal kind of rhythm of sleep as well.
That's really interesting to know the drug's efficacies and its way to help people solving their sleep problems compared to the other products. And now, what does it look compared to these like sleeping drugs that we use daily?
Yes, so it looks any kind of conventional medicine. So it's in a pack like this, and a blister pack, so an individual dosage form, which is very good for stability because you know that when you take the product and pop it out of the pack, it's fresh at that time. Something also very interesting with these specific evidence products is they come with a leaflet. And the leaflet inside helps patients who are taking the product know how to take it safely, but also what to expect when taking the product as well. So this is often prescribed by doctors. It's very much like any other medicine in the way it's presented. And I think that's also a good reason to be confident about the product because you know that this is something that's controlled and produced in a way that's consistent from product to product and batch to batch.
Thank you so much, Nigel.
It's a pleasure. Thanks, Aries.